If you are over 60 and dealing with sciatica, there is something you need to hear right now. That burning, shooting pain traveling from your lower back down through your leg is not simply a part of aging, and the standard advice most people follow, aggressive stretching, long walks, arching the back, is often making the problem significantly worse. Here is why, and more importantly, here is what actually works. Your spine after 60 is fundamentally different from a younger spine. The discs between your vertebrae have lost moisture and height over the decades. The spaces where your nerves exit have naturally narrowed. This condition, known as lumbar spinal stenosis, affects nearly 70% of adults over the age of 60, according to research published in the New England Journal of Medicine. When the sciatic nerve, the longest nerve in your body, running from your lower spine all the way down to your feet, gets compressed inside these narrowed spaces, the result is that familiar burning, shooting, or numbing sensation. What most people do not realize is that the exercises designed for younger adults with herniated discs can actually increase compression in an aging spine. A 2022 study published in the journal Spine found that extension-based exercises, the kind that arch the back, increased nerve compression symptoms in 68% of patients over 60 with lumbar stenosis. This means the majority of sciatica advice you find online is designed for a completely different spinal condition than what most seniors actually have. Today you will learn 3 research-backed exercises specifically designed for the aging spine, and 3 common daily mistakes that are quietly keeping your sciatica from healing, even if you are already treating it. Supine nerve flossing. The third exercise is called sciatic nerve flossing, and it is one of the most underused yet most effective tools for sciatica relief in seniors. Unlike stretching, which pulls on the nerve and can aggravate inflammation, nerve flossing gently mobilizes the sciatic nerve through its full pathway, reducing adhesions and restoring normal nerve movement. Think of your sciatic nerve like a bicycle cable running through a tight metal housing. When the cable gets stuck, forcing it creates friction and damage, but gently working it back and forth frees it smoothly. That is exactly what nerve flossing does. Here is how to perform it safely. Lie flat on your back on a firm surface with both knees bent and feet flat. This is your starting position. Now slowly straighten your right leg by lifting it toward the ceiling, while simultaneously pulling your toes back toward your shin. You will feel a pull along the back of your leg. Hold for just 2 seconds. Then lower the leg back and point your toes away. That is 1 repetition. The movement should be slow and controlled, never forceful. A critical detail: you should feel a gentle tension, not sharp pain. If pain shoots down your leg, reduce your range of motion. Work within a comfortable range and gradually increase over days. Perform 10 repetitions on each side, twice daily. A 2023 study from the Journal of Orthopedic and Sports Physical Therapy followed 180 seniors with chronic sciatica over 8 weeks. Those who performed nerve flossing twice daily reported a 54% reduction in leg pain intensity, compared to 31% in the group doing standard hamstring stretches. The researchers concluded that nerve mobilization addresses the root mechanical issue, rather than simply managing symptoms. Seated forward decompression. The second exercise directly addresses the compression that is causing your pain. Sit on the edge of a sturdy chair with your feet planted firmly on the floor. Spread your knees wider than your hips. This position is essential because it creates room for your torso to fold forward between your legs. Begin by tucking your chin gently toward your chest. Then slowly round your shoulders forward and let your hands slide down your legs toward your ankles. Do not force the movement. Let gravity do the work. Your back should round completely, creating a C shape that gently opens the spaces between each vertebra in your lumbar spine. At the bottom of the movement, take 3 slow, deep breaths. Research from Osaka University, published in 2021, demonstrated that diaphragmatic breathing in a forward flexed position increases the intervertebral space by an average of 1.8 millimeters in adults over 60. While that may sound small, it is enough to meaningfully reduce pressure on a compressed sciatic nerve root. To come back up, do not jerk upright. Walk your hands back up your legs slowly, stacking your spine vertebra by vertebra from the lower back upward. Take a moment before repeating. Perform this movement 8 times, holding at the bottom for 3 full breaths each time. This exercise is particularly effective first thing in the morning, when spinal compression is at its highest after a night of inactivity, and again in the evening after prolonged sitting. The science behind why this works is straightforward. Forward flexion increases the posterior intervertebral space, which is precisely where the sciatic nerve roots exit. A 2020 review in the European Spine Journal analyzing data from over 2,400 patients confirmed that flexion-based decompression exercises produced significantly better outcomes for stenosis-related sciatica than extension or neutral spine approaches. Side-lying clamshell. The first and most important exercise addresses something the other two do not: the muscular weakness that allows sciatic nerve compression to develop and persist in the first place. Most seniors focus entirely on stretching and mobility for sciatica, completely ignoring the gluteus medius. This muscle on the outer hip plays the most critical role in stabilizing the pelvis and reducing spinal load. When the gluteus medius is weak, the pelvis drops on the opposite side with every step you take. This creates a repetitive lateral shearing force on the lumbar spine, directly compressing the sciatic nerve roots with every single stride. Strengthening this muscle is not just helpful for sciatica. Research from the University of Delaware found it to be the single most important factor in long-term sciatica resolution in adults over 60. Here is how to perform the clamshell correctly. Lie on your side with your hips stacked directly on top of each other. Bend both knees to approximately 45 degrees, keeping your feet together. Now slowly rotate your top knee upward toward the ceiling, opening like a clamshell. The critical point: keep your pelvis completely still. Do not let your hips roll backward. Hold at the top for 3 seconds, feeling the contraction in your outer hip, then lower slowly. Begin with 15 repetitions on each side, as this becomes easier over 2 to 3 weeks. Add a light resistance band just above the knees. A 2023 clinical trial published in Physical Therapy followed 240 adults over 60 with chronic sciatica for 12 weeks. The group combining nerve mobilization with progressive gluteus medius strengthening experienced a 71% reduction in sciatica symptoms. More significantly, at the 1-year follow-up, 83% remained pain-free compared to only 41% in the stretching-only group. This is the difference between managing sciatica and actually resolving it. Now you have 3 powerful, research-backed exercises working in your favor. But here is what most people never find out. There are 3 daily habits that silently undo every bit of progress you make. You are likely doing at least one of them right now, without even realizing it. Mistake number 3. The third mistake is sitting for extended periods in the same position. When you sit for more than 20 to 30 minutes without shifting position, intradiscal pressure in your lumbar spine increases significantly. A landmark study from Decompression found that sitting generates approximately 40% more pressure on the lumbar discs than standing. Over hours, This sustained pressure gradually compresses the sciatic nerve roots and starves the surrounding tissues of the fluid exchange they need to heal. The correction is not to stop sitting. It is to introduce micro-movement every 20 to 25 minutes. Simply stand up, do a brief forward fold, walk for 60 seconds, then sit again. Setting a timer on your phone makes this effortless. This single habit change, consistently applied, reduces cumulative nerve compression by a meaningful degree over the course of a day. Mistake number 2. The second mistake happens while you sleep. When you lie flat on your back with both legs extended straight, the natural lumbar curve deepens due to the weight of your legs pulling on the lower back. This sustained extension position closes the intervertebral spaces throughout the night, keeping constant pressure on already irritated nerve roots for 7 or 8 hours. The solution is simple and immediately effective. Place a firm pillow under your knees when sleeping on your back. This flattens the lumbar curve, opens the posterior intervertebral spaces, and allows your sciatic nerve roots to rest without compression throughout the night. For those who sleep on their side, the mistake is allowing the top leg to drop forward without support. This creates a rotational torque through the lower spine. A pillow placed between your knees eliminates this rotation entirely, keeping your hips aligned and your spine in a neutral, decompressed position. Mistake number 1, the most damaging mistake, is also the most common one. When sciatica causes leg pain or numbness during walking, many seniors push through it out of determination or because they have been told that walking is good for back pain. Walking is beneficial, but walking through active nerve pain is not. When your leg becomes numb or pain intensifies during a walk, your sciatic nerve is actively being compressed with each step. Continuing to walk in this state causes what researchers call neurodynamic stress, which increases inflammation around the nerve and extends recovery time significantly. The correct approach is interval walking. Walk until you notice the first signs of discomfort. Then stop, sit, and perform the seated forward decompression from exercise 2 for 60 seconds. Allow symptoms to settle, then continue walking. This approach, supported by a 2021 study in the journal Pain Medicine, produced faster recovery and longer walking tolerance over a 6-week period compared to continuous walking despite pain. Sciatica after 60 is not a life sentence. The combination of nerve flossing, spinal decompression, and targeted gluteus medius strengthening addresses the actual mechanical causes of your pain, rather than simply masking symptoms. Correct the 3 daily mistakes alongside these exercises, and you give your sciatic nerve a genuine opportunity to heal. Start with the exercises today. Be consistent. Be patient with your body. The research is clear. Significant improvement is achievable at any age with the right approach. If you found this helpful, share it with someone who needs it, and drop a comment below telling us where you are watching from and how long you have been dealing with sciatica. We read every comment.